A grandmother of 14 is one of the first people in Indiana to have a brain surgery that doctors used a new robotic technology during.
Yeah, so the technology is allowing doctors to remove tumors that they would not have been able to remove in the past. Brittany Lewis, you actually spoke with the neurosurgeon, you spoke with the woman. She had this, I guess, this surgery just not long after she found out about it.
Yeah, just 2 weeks, so a very scary 2 weeks for her. And she was actually, Lisa Foster, only 2 days away from a cruise when she went to see a doctor who gave her life-changing news.
Pictures that we can tell where we are.
It's not often one gets to stop.
You gonna be okay?
Yeah.
And stare at a moment
I was very scared.
when their life changed.
I wasn't scared of dying, I'm just not ready to die.
How could she be? A mom of 5, a grandma of 14, with a fireplace full of stockings for the holidays. Lisa Foster was healthy by all means until earlier this year.
My neck was, real stiff and I had a lot of pain. And I looked on the internet like everybody else does, and I thought I had MS because check.
But a check of an MRI from her doctor revealed something else.
She said it's a gigantic tumor in your brainstem.
It was not cancer, but the tumor was located on her brainstem where the brain meets the spinal cord, and it had to go.
We chose the goal of trying to get as much of the tumor out as possible, with knowing that we didn't want to injure some of the vital nerves or the brain stems.
Dr. Shaw, a neurosurgeon at IU Health, did that with the help of new technology, a digital microscope attached to a robotic arm that turns and moves, and the image shows up on a big screen, giving the surgeon a better picture of what they're seeing. It also gives surgeons a roadmap so they can navigate around certain areas of the brain.
There are tumors, as I mentioned, that we wouldn't have attacked because of the risks involved that we now go after.
Dr. Shaw went after Lisa's for 8 hours to give her the chance to look back on all of her life-changing moments.
I'm just grateful that I came out okay, and I'm not.
So after her surgery, Lisa spent 32 days in the hospital and a week in a rehab facility. Doctors did not remove all of her tumor to avoid the possibility of her maybe needing a feeding tube. So that's something they will continue to monitor. But she is hoping to go on a cruise here in the next few weeks. So fingers crossed for her.
Absolutely. And again, her success with the brain surgery, does this translate to other forms of operations?
Yes. So IU Health got this back in September. They used it now in about 60 patients, and they're using it a lot on stroke patients to remove bleeding from the brain.
It's so interesting.
Fascinating stuff.
Yeah, great story. Thanks so much, Brittany. It says